Good afternoon, everyone. So I'm Yolanda Evans, one of the physicians over at Seattle Children's Hospital representing our telemedicine group, and I'm here with Jovanna McKinney, who's going to join us about halfway through the presentation. And we're going to talk about telemedicine in the Pacific Northwest. So starting from the first slide, this is our NCE exhibition at the AAP conference. So for some innovation in healthcare, at Seattle Children's Hospital, we use telemedicine and video conferencing to connect our families and patients with subspecialists at our major hospital. And telemedicine provides numerous solutions to some of the challenges that we have in the Pacific Northwest. One of the big challenges is limited access based on geography. We actually serve quite a large region, and we're going to talk about that. And we're going to talk about exactly how much in a few slides. And so telemedicine provides access to our specialty services at the hospital for that larger community. One of the other challenges is that there's a lack of subspecialists in our area for the patients that we serve. And so having access to subspecialty clinics and providers in the Pacific Northwest is a major bonus of having telemedicine services available. In addition, telemedicine provides learning opportunities for providers in the community as well as trainees out in the community as well through participation in things such as Grand Rounds, Tumor Board, and other conferences. And finally, there's limited funding to pay for bringing subspecialists out into the community and the rural service sites. And so telemedicine actually helps us save costs on transporting not only providers out to the sites, but also bringing the patients and families out to Children's. It saves costs and travel time as well. So just to talk a little bit about the history of telemedicine in Seattle. So back in 2001, which amazingly was a decade ago, time flies, we actually had the goal to enhance our access at the hospital. And so we applied and received a federally funded appropriation grant in the tune of $3.1 million to actually start our telehealth and telemedicine services. And this provided interactive video and teleconferencing and the infrastructure in terms of equipment for some of the community practices as well to help provide diagnostic and management tools for 11 different sites around the Pacific Northwest. But in 2005, our funding actually ended, and so since then we've been working to make the infrastructure and keep that in place so that we can keep the telemedicine program thriving and growing. So speaking as to our large geographic region, the next slide is actually about our participating sites. So at Seattle Children's, we serve what's called the WWAMI region, which is Washington, Wyoming, Alaska, Montana, and Idaho, the 5 states that are represented on this slide. And that, as someone pointed out a minute ago in the audience, is about 27% of the landmass in the U.S., so over a quarter of the nation's landmass, basically. So on this slide, we have our 10 different clinics that are equipped for use of telemedicine, and you can see that the range is quite broad, that we have everyone from cardiology reading fetal echocardiograms to dermatology to neurology, neurodevelopmental clinic, genetics, nutrition services, psychiatry and behavioral medicine, which is one of our largest contributors to using telemedicine, and then also pulmonary, rheumatology, and dermatology as well. And so now I'm going to turn it over to Jovanna McKinney, who's our operations manager, to talk a bit more about some of the details.
Thank you very much. So moving on to the next slide, frequently when we think about telemedicine, we're asked about any profit margin. Does anyone make money, and how are you billing for telemedicine? We think more in terms of savings, and we think about travel and also the time saved for a provider seeing a patient. And our long-term goal would be that a provider could see patients in person and the next patient via telemedicine all in the same afternoon in clinic. So you can see that we're nearing the 2,000 visits, consults per year mark, saving almost 500,000 miles traveled. That's both for our patients and families as well as our providers. And the fun numbers, we have had a 34% increase in our telemedicine visits from 2009 to 2010. And the last year we've spent building our infrastructure in order to anticipate growth in the coming years and expand our telemed service to even more of our specialties. So we went from less than 100 in the initial conception in 2001, or inception in 2001, to a little over 2,000 in 2010. In the next slide, you see an example of the equipment we use for a telemedicine visit. So on the left, you see the equipment in the provider's office or in the clinic setting. And on the right, you'll see where the patient would experience. So a monitor on the wall. And a question about cost and what would it cost me to start a telemed service. Anywhere, depending on the equipment that you decide to use, from $5,000 to $10,000 typical for cost. In the next example, we have a regional echocardiogram, so performed at the regional site by the echo tech, and a live read that's transmitted to our cardiologist at the hospital, and the results transmitted back to that regional site for the provider to share with the patient and family. Some questions to ask if you're considering getting your practice started using telemedicine. Is there a need? Do you have rural families and difficulty accessing subspecialty care? Is there a medical center that's currently using telemedicine in your region that you could connect with, consider collaborating with, or would you be the one to start? Obviously, different scenarios requiring different level of investment. And do you have the necessary equipment, or does the regional site have the necessary equipment to get started? Another important question, is this service covered by payers? The difficulty is right now in the industry, some payers are a little bit quiet about telemedicine and whether they want to acknowledge or pay for such a service. So important to start by communicating with your payers about whether they're condoning the telemed service, if you will. The next slide, we have some links. The SeattleChildren's.org is our main website, and telemedicine link there. And also a couple of our studies. We have our ADHD telemental health study, and then also our PALS, or Partnership Access Line, consultative service for access to our behavioral health providers. Thanks.